Started. So a warm welcome to everyone sitting in this room here at the Royal College of Paediatrics and Child Health, and to all the people who have joined online. So unbelievably, this is the 8th Epilepsy12 and Open UK conference, and this is the third time the conference has been run in a hybrid format, which has been very successful and environmentally friendly and all those sort of things. So glad to see so many people both here in the room and online. So if you've attended this conference before, you'll realise that the conference aims to amplify the voices of children and young people with epilepsy and bring professionals together to support the ongoing quality improvement in paediatric epilepsy care in England and Wales. And as someone working in Scotland, I think we've got a lot to learn from it as well, so I'm sure we will. So if you have joined online, you will already have downloaded the conference app, so you're ahead of the curve. If you're in the room, you may not yet have got the conference app, and you can do this by scanning the QR code that's on one of these pillars here, and that you just enter your email address that you have registered for the conference, and that enables you to use the app both whilst you're here and also to later on if you want to look at the presentations again. So you can use that app if you want to ask questions online, or if you want to ask questions in the room, or if you want to ask questions in the room, just raise your hand as well. So it's a really useful app, and I hope it helps facilitate the day in a smooth way. So for the people who are in the room, just a couple of housekeeping things. There is no expected fire alarm, so if the alarm rings, ding, 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 we need to get out, and we need to go where, Salima? Okay, follow the fire exit signs. Out the door, follow the fire exit signs. The toilets are just outside on the corridor here. Out the door, turn left, and there's some on each floor. And there is going to be some filming today. And if anyone's got any concerns about that, please speak to Salima and Nikki. So you'll have seen the programme. So each presentation has 50 minutes allocated to it, about 40 minutes for the speaker, but then about 10 minutes for us to have some discussion and so on. So hopefully you'll all have plenty to say. I see people in this room who I know will have plenty to say, so it'll just be a matter of trying to control the narrative, I imagine. Okay, so without further ado, I'm going to introduce our first speakers, and these are our Epilepsy12 youth advocates. So these are a group of epilepsy experienced or interested young people who volunteer to help shape the Epilepsy12 audit and advocate for children and young people with epilepsy. They're going to be supported by an epilepsy specialist nurse and the RCPCH engagement team from RCPCH and us. They're going to present on our recent projects. So 4 of them are here. We've got Hannon, Grace, Demi and Zaksky. And I'd really like to welcome them up to the podium just now. Thank you.